Hi, I have done a stromal vascular fraction injection for this 62-year-old young gentleman from Calcutta. His name is Mr. Banerjee. He is quite active and he didn't want to undergo a knee replacement. He was advised a knee replacement in Calcutta, but he didn't want to undergo this after having seen previous cases. He looked around in Calcutta and he came finally to Chennai to have this procedure. It's 2 days since the procedure was done, and now I'm going to introduce you to him and we will hear from him. Hello, Mr. Banerjee, welcome.
Hello, Dr. Saab. This is Santanu Banerjee from Kolkata.
Ah.
I am 62-year-old male and very much active in my profession. What happened is that the case is like this. I was developing some sort of osteoarthritis for the last few years, but I had some knee pain and I had undergone a series of prolotherapy, I mean normal prolotherapy treatment and dextrose injection along with hyaluronic acid injection in Kolkata. But even in spite of taking those treatments, things improved little bit over the next 2-3 months, but finally the pain again started coming up. And I went for some sort of MRI and X-ray in Kolkata. They showed that I had grade 3 osteoarthritis. And most of the doctors in Kolkata suggested me to go for knee replacement or a surgery, knee surgery. But I had bad experience amongst my relatives. I had seen a couple of cases, including my mother, who had knee surgeries and were put in the hospital and then in lot of physiotherapy, a long recovery process and all these things. So I didn't want to get myself, into all those things at this age, since I am still actively working in my profession and I want to do it for at least for the next 4-5 years. So I came across the website of Dr. A.K. Venkatachalam in Chennai. I talked to him over the phone from Calcutta and I decided to come down to Chennai. I came to Chennai about like five days back.
23rd.
23rd.
Ah.
Yes.
4 days back.
4 days back.
Ah.
I came to Chennai about 4 days back and had a couple of consultation with the Dr. Venkatachalam in Chennai Meenakshi Multispeciality Hospital. He went through the entire process and he has spent a lot of his valuable time for me and recommended to go for adipose fat cell therapy system, where my fat will be extracted from the upper knee joint or from the thigh and all these places, and then it will be given in the from my body only. It will be injected back in the knees. So day before yesterday, I think that was 25th of January, I had the surgery started around 6 a.m. and the doctor treated me very well. I mean, there was this adipose suction. First of all, liposuction. So it first of all started with the liposuction technique, and it took some time because the fat has to be extracted from proper places and the quantity and volume has to be correct. So that took some little bit longer period, but anyway, it was done under anesthesia and not much of a problem. And after the fat was extracted from the upper knee, thigh level, from the buttock region, they were put in centrifuge machine, and the things which will be injected has been separated out, and then it was injected into the knee. That took another like maybe 1 hour or so. So I had this procedure done on 25th. Today is I think 27th. So 2 days have passed by. More than 48 hours have gone. I have come here for another round of checkup and replacement of my dressing. It seems to have gone pretty well. I had some sort of pain on the very first day evening, but then it subsided gradually, and today I am much better. I am able to walk quite freely, and the doctor has been kind enough to make a change in my dressing. He changed my dressing and everything, and I had a very good conversation with the doctor. So in fact, once I go back to Calcutta, I'll be willing to recommend this place to my near and dear relatives who are thinking of knee surgery, but knee surgery does not always work well, and there are a lot of negative factors to it. So this I think should keep me okay for the next 2 or 3 years. And that's all. I mean, yes, you have any question to ask me, please go ahead.
No, not at all. I'm very happy that you are doing well.
Okay, okay.
So things are just normal. This kind of pain is expected.
Right.
First few hours after the procedure, there won't be any pain at all because there is local anesthesia, and moreover, this adipose tissue fluid, which is called PRS, platelet-rich trauma.
Right.
It is a mixture of stromal vascular fraction, which is taken from your fat and then mixed with platelet-rich plasma. So this combination is known as platelet-rich stroma.
I forgot to mention my fat has been taken as well as separate blood has been taken. So both were both were mixed together, and as the doctor has explained, so it's a powerful technique, I should say. I mean, it's a combination of both the fat, the adipose fat, and as well as the blood, the PRP thing. So we call it like PRS, right?
Yeah. So that was injected into your knee, and that has got anesthesia. It has got a local anesthetic effect that will last for some time.
Okay,
Although
right,
I have not
right.
given you any local anesthetic into the joint, so that will take care of it. And even now, you don't have any pain in the knee joint as such.
That is absolute correct. I don't have any pain in the knee joint right now. Little bit of pain is remaining only on the upper portion from where the fat is taken.
Yes.
And I think that has already come down quite a bit. So absolutely no pain in the knee joint. Okay. So that is one.
And
thing.
the swelling in the knee joint which you are having, that was pointed out to you. That
Yes.
also has settled down.
Yes.
So
That has settled down.
this biological combination of PRS is anti-inflammatory. It will make the inflammation settle down inside your knee joint,
Exactly.
regenerate cartilage to a limited duration, and its effect should last, as you said, for few years, 2 to 3 years, and
Right.
even maybe more.
Right,
Even
sir.
after that, if you have any recurrence of, I have had patients who are doing well after 7 or 8 years.
Okay.
So if you have any recurrence of symptoms, it can be repeated.
It can be repeated.
So
that's a good thing.
that's
yeah.
not a good. That's a very good thing.
Very, very good thing. Yes.
And I don't think this is much better than having to undergo a knee replacement.
Yes. Absolutely.
You
agree.
have witnessed a knee replacement in your family firsthand.
Yes, and that I mean that is the main principal reason I didn't want to go for a knee replacement. So
this is a knee replacement alternative
alternative. There's a knee replacement alternative
without
Absolutely.
any surgery.
Without any surgery. You just spent 2 or 3 hours, and it's a little bit of recovery process is only 1 day, I should say. 24 hours, that's it, nothing more than that. And you have normal physical physiotherapy, physical exercise, stretching, bending, whatever it is. So everything is normal.
You are aware of those exercises.
I am aware because I have been already doing it.
Okay,
prior to
so
coming here.
you remember what I told you today.
Yes.
Okay, so do them. 2 weeks, take it easy. After 2 weeks, start building your exercise thigh muscles.
Right.
Then after 6 weeks, you can start going out.
Okay.
No venturing out outside your house
Outside,
for until 6 weeks.
Until 6 weeks. Okay.
Okay.
Got it.
Thank you, Mr. Banerjee.